Hi, my name is Nicole Wisnett, and this is my Unit 6 Mental Health Disorders in Athletes. Now, before I talk about some different kinds of mental health disorders, I'm going to be talking about the definition of it. So, mental health disorder is a clinically significant disturbance in an individual's cognition, emotional regulation, or behavior. So, basically, anything that really happens in the brain. And it's usually associated with distress slash impairment in important functioning areas. And, to really to mess up or distress those functioning areas, it doesn't take a lot. Like, it could be a short circuit or anything really, like, it can be small and it can really affect it. And there's also many different types, which I will be talking about. Now, I won't be talking about ADHD, but I will be talking about eating disorders, anxiety and stress, depression and suicide, excessive training, and body dysmorphia. But first, we're going to talk about some short term effects. Almost any athlete can probably feel these from just short term, really feeling the heat of the mental health disorder. So there's fatigue and major loss of energy, so just really tired all of a sudden. And that can also move into like demotivation in what sport they're doing in practice and games. Moving and talking slowly, just because of the fatigue and the major loss of energy and difficulty concentrating. Mental health disorders can really affect how well you're able to concentrate on certain things, especially as your athletic performance. Now, some long-term effects are like talking like more about retired athletes or athletes who have been feeling the haze of the mental health disorder for a really long time. So especially retired athletes can still feel all the effects of the mental pressure of the sport, kind of like Michael Phelps. And after he had retired from swimming, and basically, he had to go to therapy for a really long time after that, just because of how much mental pressure he still felt, even though he wasn't swimming. He felt like he needed to do more, even though there wasn't really more he could do because he had already won the Olympics quite a few times. But a second one is hinder rehabilitation and return to sport process. So the more of the haze that they feel from this disorder, the more it's going to hinder the motivation for the rehab process and the return to sport process and actually doing it correctly. And there's also a really good chance of re-injury as the depression of that disorder really hinders the performance of that athlete. Now, the first one we're going to talk about are eating disorders. So, an eating disorder, they're behavioral conditions characterized by severe and persistent disturbance in eating behaviors and associated distressing thoughts and emotions. Now, there's many different kinds. I'm not going to be talking about all of them, but here are just examples. Some like bulimia, binge eating, avoidant restrictive food intake disorder, anorexia. And the overall effects from an eating disorder is really bad. I mean, you could have osteonopia or osteoporosis, which is the thinning of your bones, mild anemia, which is low iron, muscle wasting and weakness, brittle hair and snails, dry and yellowish skin, growth of fine hair all over your body, severe constipation and low blood sugar as your body is not receiving all the nutrients that it needs to run as it normally should. But if you like to help with this kind of thing, it's really hard to raise awareness and really get someone who has an eating disorder back on the right track. I mean, if you've noticed anybody, speak out. If you have talk to an affected person, like an infected person with the disorder deeply about it and try to get an understanding. If it's bad enough, medical treatment is very important if they're not getting all the nutrients they need to live, and nutrition counseling to really show them that what food is not the enemy. Now, the next one I'm going to be talking about is anxiety and stress. Um, so, anxiety is a feeling of worriness, nervousness, or unease, typically about an imminent event or something with uncertain outcome. So, for a lot of athletes, this is really prominent in their performance in games, like or states or regionals, as it's a lot of pressure on them to feel like they have to win. I'm not going to be talking about all the effects just for time's sake, but you can have trouble concentrating or making decisions, feeling way more irritable, maybe a little bit of nausea or abdominal distress if you're really, really hyperfixated on something. Trouble sleeping, having a sense of impending danger, just really unsure about the situation and makes your performance way worse. There's specific types. There's generalized anxiety disorder, panic, specific phobias. There's a lot of different ones other than just anxiety and stress. It's not just one thing, it's a spectrum. So, and for anxiety, for these kind of people to really help them, you can help them make game plans, you can teach them breathing techniques, they can have cognitive rehearsal and visuals to channel that energy and focus. And really, that's like, VR, or like putting a video and like having them practice without all the stress, just like getting a game plan to get around that anxiety. Now, the next one is depression and suicide. So, from this one, it's a lot of like feeling overwhelmed. You're not effectively managing the stress and anxiety that you might have been feeling before, overtraining, excessive training, intense injury. A lot of this can make an athlete feel very depressed and sometimes suicidal. Symptoms are changing behavior, decreased performance, more physical complaints, academic struggle, social isolation, and changes in eating patterns. As a lot of athletes don't feel like they're doing enough, so they're not going to treat their body as if it's doing enough as well. And for depression, I mean, the most that a lot of people can do is show support, help them seek out therapy, encourage balance in their routine just to get back into the routine of things, maybe. Um, and good nutrition and sleep schedule. But if it's bad enough, they might need to be going on some medicine, but, really refer them to the best. Now, the next one I'm going to be talking about is excessive training and body dysmorphia, as these two typically go hand in hand. But if you don't know what body dysmorphia is, it's a mental illness involving obsessive focus on a perceived flaw in your appearance. Symptoms of excessive training is overtired, needing more rest, mood swings, retaining chronic injuries, overly sore muscle or limbs, not eating. I mean, this is a pretty common one for all athletes, as a lot of athletes or their coaches push them into like physical weakness, as they've just been way overtrained. They've been training hours a week. They're doing too much for their body. They think they're doing what's better for it, but at some point it's just too much, and the body's rejecting it. But symptoms of body dysmorphia is preoccupied with small physical flaws, see changes in the body that no one else sees, a strong belief, sorry, of being ugly or flawed, comparing constantly, and seeking cosmetic changes. Now, for excessive training, there's not really much you can do other than maybe seek some distractions, maybe take a day off of practice, like really just stop doing so much for your body. Maybe go to therapy if it's a mental disorder, as if you don't think you're doing enough. There's a lot of different ways. And for body dysmorphia, self-help materials, accept compliments and celebrate little successes, write a list of what you like about yourself, and support groups, really just trying to see yourself for who you really are, not for something that you see in your head only. Now, that was all of the mental health disorders that are most commonly affected in athletes. And I really just wanted to raise some awareness in what you could possibly do if you are affected by that. Thank you so much for watching my presentation.